Hi, I'm Dr. Ramey Turner, board certified in family medicine, and I'm here to talk to you today about how do I know if I have PTSD? So we're going to go over a couple of different things about what PTSD looks like and a little bit of the treatments for it. And before I go through with that, let me start with a disclaimer, and that is that I'm not your doctor. And if I am your doctor, please consult with me before you make any changes to your medical regimen. Otherwise, consult your own private doctor before you change anything in your medical regimen, especially based on this video. This video is for educational purposes, and you shouldn't make any changes based on someone who hasn't even seen your chart. Okay? Thanks. All right, now let's move on to the next part of the video, and that is, what does PTSD look like? PTSD, of course, stands for post-traumatic stress syndrome. So who hasn't had a trauma? Everybody's had a trauma. But if you've had a trauma and it's been over a month and you are experiencing negative emotions and feelings and avoidance, things like that, because of the trauma, and it's been going on for over a month, then there's a good chance that you have PTSD unless you have like a substance abuse problem or you have some other medical problem that could be causing you to lash out instead or have those same symptoms. There are 4 different things that we look at on how PTSD will manifest, and one of them is intrusive thoughts, and that is like things that come into your mind that you just didn't mean to. Maybe sometimes something will trigger a memory and you'll just think of something and you didn't want to think of it, but every single day you think about it. So these things come up so often that they actually affect your ability to just get through a day. Another thing might be avoiding things, avoiding your family, avoiding your friends, avoiding the things you used to like to do, avoiding places, stuff like that. So those are some ways, and this hallway to me kind of demonstrates what's going on with PTSD. You see there's a lot of lockers, and all of those lockers have combinations or no locks or some locks or something. And this is how your mind is in terms of like memories that you can pull out and memories that you can't find. And when you can't find a memory, particularly if it's a trauma, you can have symptoms of PTSD without actually knowing what the trauma was. So when you hear about these different things, keep that in mind. Other things that can happen as well that we look for, things like negative changes in your mood or cognition, difficulty concentrating or being more irritable or difficulty remembering what's going on now, remembering what happened even, and we can explain how that happens. Or maybe you're just really easily triggered with things that didn't used to bother you, but now they do. And you have like a hyper reactivity to that. Maybe you startle easily, or you're just super hyper vigilant looking around to see what might happen and go wrong in your life, whereas before you were fine, now you're not. Or perhaps you're always hyper vigilant, you're always tense because this has been going on for a long time and maybe you don't remember. So this is why I say, if you're having these feelings, another thing that you may feel is hopelessness or depersonalized or no feelings, or very little. You see everyone getting excited about going somewhere and you could sort of care less. It's not that big a deal. I mean, what's the deal on everything? Not just the things you don't like, but things that maybe you used to like, but it's just not that cool. I mean, we're going to go see a movie, so what? Or you're having feelings where it's like, I should feel more sad, but I just don't feel anything. I am sad, but I just don't feel anything. I don't know how to tell people. I just don't feel it. I don't know what's going on. Does trauma always lead to PTSD? No, it doesn't. A healthy individual who experiences a trauma will see the trauma or experience the trauma and say, hey, that was a really bad thing. And then that really bad thing disappears in the noise. They remember it. Oh yeah, that bad thing happened, but it's over now. And they're on with their life, and they're not thinking about it. They're not avoiding. They're not feeling fear. They're not trying to avoid being in that situation or anything like that. They're just moving on with their life. But when you're inundated repeatedly with one trauma after another, or you had your trauma when you were early and you were not mature enough to deal with the trauma that occurred, then sometimes it leads to residual symptoms that are difficult or impossible to work out, especially if you can't remember what happened. And there's some reasons why you might not remember that. And part of that has to do with how the brain reacts when you experience a trauma, and that is that the verbal part of your brain just shuts down. And so, although you can see what's happening, you can't verbalize what's happening. And so, even to yourself, you can't say words that describe what happened for a while. Sometimes it takes a lot of work to get there. So, that's how it works. What do we do for PTSD? Well, for a long time, we just gave antidepressants and anti-anxiety medicines and sleeping medicines, basically treating symptoms and numbing people out and making it difficult for them to actually process the trauma. So we basically just kind of put them on hold with a Band-Aid that didn't really work too well. And we suggested therapy, cognitive therapy, some kind of therapy to work through the trauma, but that didn't seem to work either. Working with groups worked a little bit, but not great, because sometimes you can't remember what you can't remember. So how are you going to talk about it? How are you going to relate to it? So, are you doomed? Going to relive your trauma? Well, in order to get through your trauma, you're going to have to relive your trauma at least once. Yeah, it's the only thing that really has been noticed to work, is to actually go through and work through the trauma. And you got to be like, nah, who wants to do that? Well, surprise. You're already doing it. You're doing it every day. You wake up in the morning thinking about it, or you go to bed at night thinking about it. You wake up in the middle of the night thinking about it. You act out because of it. You're thinking about it and talking about it all the time. You know this. So you're reliving it every day. And even if you're not reliving it verbally, even if you're not speaking about it verbally, it's still in your mind. You're still avoiding those things. You're still doing all of those things that are basically making your life more difficult. So why not relive it in a healthy way that works through it? And that is through therapy best. My favorite therapy that I've read about in all the different things that I've looked at is called EMDT. That's an acronym, fortunately, for a word that I hope I can say, and that's eye movement desensitization. Is that it? And reprocessing therapy. And how it works is basically by using eye movements back and forth. Both sides of the body need to be involved, and it doesn't have to be your eyes. It can be your hands. You can be using your hands, touching your fingers, something like that, while thinking through a traumatic event. Whatever you can remember, or just thinking through, hey, I have a body sensation that's abnormal. Is it possibly related to something that I have had experience with? And somehow through that process of the physical movement, it's able to help that language area of your brain bring forth memories that help you process it. Because knowing what you're dealing with is so much better than not knowing. And knowing that you can now take control of what's happening and reprocess it and turn it into, that was a bad thing that happened. When you can get to that point, and you can, then you can go, yeah, that's stupid. That person was a bad person, and I ended up there because, well, I was in the wrong place at the wrong time. I was young. I don't know. Somebody else did it. I'm not at fault. I'm not guilty. And even if I am, there were reasons, extenuating circumstances, and you're able to process through or work through and do what you need to do to help yourself get healthier. So I really like this particular therapy, which I got from a book called Your Body Keeps the Score, written by Bessel van der Kolk and a couple of other authors. But this book I really can't recommend enough. And I've also put the link to the book, the name of the book, and a link to finding guidelines on how to do these movements, and also how this works, and some studies in the description below. So I hope you can make use of that, as well as a link to my website at rameyturner.com. And while I'm thinking about it, be sure and like and subscribe, and share this video if you know someone who is experiencing PTSD, or you think they might be, or they're having trouble with it. What about psychedelics? Man, that's all over the news. Everybody thinks that's really exciting, and it just might be. It turns out that the studies are now either in their phase 4 trials, which is pretty much the end, and they start working with patients with this. So you may actually, by the time this video is out, find someone who can help you with that. And so what it does is it helps you to experience the trauma, but you don't care because you're under the influence of a psychedelic. So you can see it. The only issue that I have with this is psychedelics are hallucinogenic, and it could go bad. So if you're going to do something like that, be sure that you do that with professional help. Don't do this alone. Please use a doctor or a doctor assistant, but someone who knows what's going on to help you work through this, so that in case something goes wrong, even if it's a health problem or if it's a psychological problem, they will help you with that. Here's our psychedelic colors. Now, what about cannabis? Cannabis is also a medication that has been shown to help with PTSD. It helps in the same way as the psychedelics, but it's not hallucinogenic in general. You may disagree with me if you were back in the 70s, but don't forget that in the 70s, when you could buy it off the street, or if you're buying it, please don't be buying this off the street, but if you are, sometimes dealers like to put extra stuff in there. So if you hallucinated on it, that's probably why. Otherwise, if you take too much, you just fall asleep. The good thing about it is that you can work through the process of trauma doing the same type things as we talked about before, but in a situation where you are calm, because it keeps you calm, and then you can process it in your mind, and you don't forget. You process it through your mind, and it can work through. But I say that with the caveat that if you are going to take medical cannabis, be sure you know how you react, because there's sometimes a side effect of paranoia. And if that happens to you, this is probably not the best way for you to go if you want to try to work through your PTSD. The EMDT would be okay, but as far as doing the cannabis, I would leave that out until you know how you react. Most people don't get paranoid. Most people just simply feel calm. And sometimes it's the type of cannabis that you're exposed to. So those are things that you want to take into consideration. If you decide that you want to try to do EMDT on your own with cannabis, be sure you're with a trusted friend or someone that you can talk with as you go through it. Don't do this by yourself. Don't do that by yourself. So basically that's it. Hopefully I've explained enough of PTSD to you that you can understand whether or not you have it or not, or it's something that you can do. And I'm giving you some tools about what can be done about this, some links that you could go to. I'll be putting a longer course online in a few days about where you can get more help and some more information about how EMDT works and things like that. So come on back to my channel and revisit and find out more. There's other health topics as well. And finally, life is going to move with or without you. So if you're going to live your life in fear, that's your choice, but you do have the ability to take control of your emotions and take control of your feelings and do something about them. I'm not saying repress them. I'm saying do something about and work them out. Get them worked through, and then you can have your life back. So, start whenever. I hope you start soon, and I wish you best. Don't forget to like and subscribe, and I'll see you on the next video. Thanks. Bye-bye.